Welcome back, Brian Calfano, along with Amy Blansett and Nick Reed. Excuse me, sorry, I had to clear my throat. Folks, we're dealing with corona, and I don't mean the alcoholic beverage. Of course, it's the coronavirus that has everyone concerned. And whether you think it's hype or not, the government has been trying to convince people not to get together and share germs and other things. It is officially a pandemic according to the World Health Organization. The government, though, doesn't seem to have the kind of leaning in, forward-thinking handle on this that some people want. And I think I know where Nick's going to go with this. You got to save yourselves, right? Because it's not
can't expect the government to save us for sure.
I could just talk for you, Nick. It's not the government's responsibility to keep you well, right? So I just wonder, as you watch all of this unfold in slow motion, whether you think it's hyped up or not, where do you come out with how effective the government's been in trying to get a handle on this? Start with Nick.
Well, I look at it in a number of different angles. One, how are we reacting to this compared to other, if you want to call them pandemics? Or I mean, I know we've all heard the conversation about the tens of thousands of people that die every year because of the regular flu, and the percentages compared to those who actually get it. And I think there needs to be a reflection on and an understanding of human behavior. And the reason that we don't make a big deal, frankly, out of 50,000 people dying because of the standard flu every year, is because we're used to that. We're just used to it. I mean, that is something we're used to. And when you become used to something, when you become accustomed to it, it no longer has an emotional engagement with you on the same level. This is new. And it's something that we don't really know, and we don't have vaccines for it. And so because of the newness component and some media, political components to it as well. But without even getting into that, just the recognition that sometimes new things, we have emotional responses to them, even if it's something that we've been through before. And it's okay to recognize that. It's, I think, also okay to recognize that there is something that's very serious without screaming it out loud. I equate it to when many of us were in school as kids, and then especially in these parts, tornado warning, you're in school, and we all had been through the drill, and the teachers, all right, everyone get up, quickly, and they get us to the gymnasium or the hallway and get everyone down. They don't scream and yell. They don't say we're all going to die. They don't say you have no concept of how, Johnny, you are not taking this seriously enough. Don't you understand you could die? That doesn't mean that they don't appreciate the magnitude and the seriousness of it, and that it can go terribly wrong while hoping for the best. But we tend to be gauging the level of seriousness in which this is approached by people in government with how hysterically they're screaming about it. And that isn't always the case. It's okay and understandable to take a serious approach and to be calm about it and to say, listen, this is how things could go, but we're hoping for the best. This is what we're doing. And let's not at this point act like we're here if we don't have to yet.
But Amy, there's been criticism that the hospital network and the government investment in making sure there's enough surge capacity in hospitals to be able to deal with folks who need ICU beds and ventilators and that sort of thing, just not there. I mean,
Correct.
If it gets really bad, there are not enough capacity.
And we had time to be prepared. And I think that's what's important. And I will agree with you on government does not do many things correct. And this is one of those areas where we're beginning to see the delays that were put in. I think.
But a lot of the hospital networks are private.
Correct.
So they're
However,
not government in that sense.
But those private networks are trying to be prepared. We have government control on whether or not they can test someone. So we have individuals that are coming in who are saying, look, I was traveling, I may have not been in Italy or hot zones, but I know that there are individuals that were on a bus with me or a plane with me, I'm having symptoms, and I am self-electing to be tested and would then quarantine if you tell me I'm sick. And physicians are being told, sorry, you can't test that person because they don't fit this very specific criteria. So we do have government interfering with...
Making it worse.
Correct. We have government interfering with hospitals that are trying to do proactive work, and the CDC is saying, well, we're being controlled, and sorry, no, you can't test that person. We won't take the swab and test the swab. So we are seeing this like overlap of government control. And I'm really curious to see, when you were talking about other, like this isn't the first pandemic. We've had SARS, we've had others, but they weren't in the middle of a political campaign. And I really think what we're seeing is everyone trying to do it so well and so perfect and so politically correct that in essence it's actually creating more harm to the individuals that are trying to do the medical job, that are trying to respond in the way that we've responded in previous high-risk situations. And now all of a sudden there's confusion in the hospital systems because they're being told, no, you can't do it like you've always done it, because the government wants control over this.
All right, 30 seconds to each of you, because we got a time limit here. What is the one thing President Trump ought to do to get out of this crisis politically and from a management standpoint effectively?
You know, I, honestly, and this is going to sound unpopular, perhaps because the perception, because of all the screaming and yelling around him, is that he's doing a horrible job. But I think to a degree, he's really honestly doing, if you just listen to what he is doing, I think he's on a pretty good track. He's recognizing, you know, that things could get worse. We hope that they don't. He is having the vice president on a daily basis update people. The vice president is swarmed by CDC, Department of Health people, experts that are fielding questions. And so it's an aware, cautious approach. And at times, whenever we realize, okay, we need to head another direction, doing so. I'm not going to claim that every move that is going to be perfect, because no one is perfect. And particularly, and this isn't Republican or Democrat, but to your point, government as an institution is problematic at times, no matter who's running it. You know, a broken machine, it doesn't matter who's driving it. But, you know, just try as best as possible to not hear all the distractions, to hear the people screaming, you should be doing it this way instead of that way, largely from, you know, television and politicians, which I know he is one, but that's what I would advise.
Last word, Amy.
Yeah, so I would agree somewhat in the sense of the message, I think, is really important, and so how they're doing it, and keeping those individuals close as far as CDC, the World Health Organization. But I would say a little bit different. I think the message that's coming out is in the very childish method that he does through social media. Incomplete sentences and just, it's going to go away, so let's just wait and then we'll be fine. Or it wasn't our problem, so we don't want those numbers to count. I think at this time, it's time to put that away and talk more about why and how this is different. It's spreading different. The way that we can track it is from further away. So I think there's just so much confusion that there needs to be a clear message, and it needs to be in educated, complete sentences.
All right, Nick Reed and Amy Blancett, not shy at all about their views on things. We'll be back after this.